It's interesting as you talk about abortion in America and you talk about Charlie, it sounds like conversation is the through line there. The ability for storytelling and conversation to not just relay information, but to perhaps change policy. And as a journalist, I appreciate that message. So, Lauren, I want to know, what is the number one conversation you want to see people having in 2025 when it comes to reproductive health access?
Oh, that's such a good question. Okay, I'm going to cheat a little bit because there are really two. One conversation that I really want to see people having is a conversation about the importance of access to abortion pills online, pills by mail. Again, this is such an important resource. And what we're seeing both through our research at Charlie and through the conversations we've been having at Abortion in America is that there really is this glaring information gap, particularly in moments when people are most desperate to get the care they need. You're not sort of in those moments thinking back on everything you ever heard or read about abortion and remembering, I saw this resource once in an ad on Instagram. You just need a place to start and you need someone who will guide you through the process and make sure you know what all of your options are, and the fact that even if you're in a state with an abortion ban, you still have options. You always have options for care. So, one of the most important conversations, I think, is the conversation around abortion pills by mail. The other conversation that I'm really excited about, and something that we're seeing a lot of enthusiasm for through Abortion in America, is the conversation around the role of men and men's voices in abortion access and reproductive health. Some of our most compelling storytellers who we've worked with through Abortion in America have been men. We've had at our launch event in New York City, we had this incredible panel of storytellers, and I know you were there, and they were all just phenomenally inspiring and moving and really shared personal stories that I believe transcended politics on this issue. One of the people who we've heard about most from folks who are there is a man named Ryan Hamilton, who is a radio host from Texas who shared at our event and has shared elsewhere publicly the story of helping his wife access miscarriage treatment in Texas and ultimately finding her unconscious and bleeding on their bathroom floor because she had not been able to get the care she needed at a hospital in their community. And the way Ryan is able to share this story is really different from anything I think we've heard before in the conversation around reproductive freedom and abortion access. And what we're seeing is that we did some initial research when we were preparing to launch Abortion in America, and we asked people basically, do you want to know more about abortion? Do you want to hear more personal stories? And there's, first of all, a huge audience for this content. But interestingly, more men than women said they were really interested in learning more about this issue and hearing these stories. So I think what we're seeing is that men are eager to add their voices to this conversation. They're participating in new ways. We also had one of my favorite interviews we did as part of our Abortion in America work in Louisiana was two Baptist preachers who talked about the way their wives had shaped their views on this issue and why it's so important to them to preach from the pulpit about everyone's freedom to make their own decisions. So men are increasingly participating in this conversation as spokespeople and storytellers, as well as people who are eager to learn more and who are frankly changing the way they think and talk about the issue of abortion. So the conversation around men and reproductive freedom is something I'm really excited about in 2025. I think we'll hear a lot more about it.